Well, the ISHRS mission with the Black Market campaign and with trying to spread the word is patient safety. The main issue is that we want patients to beware, which is why we chose a very bold and aggressive campaign to let patients know, like, listen, stop, hold on, before you make a rash decision and choose, to go abroad or so forth, check your credentials of your doctor. Check the ishrs.org website, make sure that your doctor has been going to meetings, that he's credentialed, that he's educated in the process and he knows. And that's kind of the main thing, is we just want patients to be safe, to be aware who the doctor is and who's doing the surgery, most importantly. What I see mostly as a chair of the unlicensed practice of medicine about patients that have been harmed from the unlicensed practice of medicine is that these patients that are being treated don't really know that they're being operated on by non-medical doctors. And I think there's a discrepancy in what is being sold to the patients as opposed to what they're getting. And that is the big issue. I have doctors telling me all over the world, sending me pictures and stories of patients that have very bad results, and really they weren't aware, they didn't know. They go somewhere, they fly somewhere, and they get there and they're like, what did I get myself into? And sometimes it's too late to back out. They're already there, they're already committed, and they just have no other choice. And sometimes they don't realize it until after the fact, and they go home and they're like, what did I do? When we talk about the Black Market campaign, what it really refers to is a variety of different things, specifically clinics that are operating illegally. That is, they don't have a license where they're practicing, or they're delegating to individuals that don't have a license. And this is really an illegal action and act. The other thing is not conforming to a certain type of behavior or codes of ethics. And that's another issue which is very difficult, where patients are being deceived. And unfortunately, this happens all over the world. It's not just in one country, and this campaign is not about one country, it's not about one clinic or one doctor. It has nothing to do with that. It's really bringing awareness to the problem. And the problem is the unscrupulous clinics that are taking advantage of patients. And that is a universal problem anywhere. It's in my backyard, it's in the United States, it's in foreign countries, it's everywhere. So it's not necessarily in one location. It may occur more frequently in others because of the demand, because of the attraction of tourism, and because it might be cheaper in another country. And so it's going to be a lot higher in those respective countries. But, the fraudulent activities that are occurring, having non-medical people do surgery that don't have a license, occurs in the United States everywhere. And it's expanding. There's a positive message here. And that positive message is that we want patients to be empowered with proper information. And we want these patients to feel like they have an informed consent. And the message is, we want you to have a positive result, positive outcome, and the way to do that is to be giving you information so that everything is a wonderful result.